Colleagues, Samuel Ikon, representing Etinan, Isidibom, Lubiom Federal Constituency, Akwa Ibom State. I wish to move that a bill for an act to establish the Institute of Healthcare Management of Nigeria and for other matters connected therewith be read a second time. I so move. All colleagues, I wish to appeal for your support on this bill, which seeks to address the issue of the mismanagement of our health facilities across the country. Today, the concept of managing a healthcare system basically revolves around certain concepts. But what this bill seeks to do, first and foremost, for us to understand it, is to clearly differentiate between medical management, which universally refers to the management of patients in clinics and hospitals. Medical management, therefore, is the direct responsibility of medical and health professionals in dealing with disease situations and treatment in patients. And these are seriously regulated by various medical and health regulatory bodies in Nigeria already. We have the Nigerian Medical and Dental Council, we have the Pharmaceuticals Council, we have the Nursing and Midwifery Council. They are regulating all of this. But we also have the healthcare management, which seeks to directly plan, coordinate, organize, staff, direct and manage finances appropriately with good budgeting for effective service delivery. This remains the fulcrum within which effective healthcare delivery rotates and flourishes. But who regulates them? Who regulates the way our health institutes are managed? Who regulates them? It is therefore highly important to establish and appreciate the distinction between management of facilities, staff, and finance, and that of disease conditions of patients. Healthcare management, therefore, requires distinct knowledge, skill, and attitude, separate from medical and healthcare professional service delivery. Mr. Speaker, honorable colleagues, you will realize that the concept of healthcare management, in the perspective of what we are talking about here, involves effective interplay of medical and health professionals, accountants, engineers, social workers, architects, nutritionists, drivers, technicians, psychologists, etc. Several studies have shown that if the 20 teaching hospitals we have spread across Nigeria were properly managed by professionals who had specific training on health management, we will not have the problems we are having now. In 2002, the former president, then President Obasanjo, commissioned a project to refurbish 8 teaching hospitals, which later became 14. And a whopping sum of 50 billion was spent on this exercise. It is a well-known fact that medical and healthcare professionals, if they had the right training to manage those hospitals, we wouldn't have the issues that they had. The issues had issues of dilapidation, infrastructural issues, mismanagement, and all of that. But the question is, between then and now, after 50 billion had been spent, what is still the state of those hospitals? So we are back to square one, and the same situation still arises. This bill, however, does not seek to establish super professionals. It simply seeks to establish an institute that will take responsibility to train, professionalize the practice of healthcare management in Nigeria, which therefore means that those appointed or seeking appointment into position of healthcare management will have to acquire additional trainings in management of facility, finance, and human resources, and general management specifically as applicable to healthcare services and institutions as a matter of legislation. This is the practice in several climes outside, in the UK, the US, even in India, in Malaysia, in China, and all these places. For you to run a medical facility, you must have a specialized training. Otherwise, government continues to spend billions in setting up these facilities, equipping it, and in a matter of years, it is run down. Because whoever is in charge has no management skill. You find various departments and sections and professionals fighting and quarreling and destabilizing the facility because there is no management skill in whoever is leading it. So this is the practice out there where you may find a health facility, you'll be shocked that the person heading that, managing the facility is not even a nurse, doesn't even know anything about medicine. But because he acquires that professional qualification that allows him manage that facility and knows how to put all the professionals in place for the best use of their knowledge in enhancing the productivity of the place, is allowed to head. I therefore seek the support of this Honorable House for the establishment of the Institute of Health Management of Nigeria. This institute will be a professional body in Nigeria that will regulate, train, keep, and maintain register of healthcare managers and set standard of practice for IHMN professionals in Nigeria. It will from time to time determine the set standard of academic knowledge and skills for anyone to become a registered member of the institute, planning, research, and operate consultancies, training services for clients, health and social care related professionals with specialization in healthcare management. Mr. Speaker, honorable colleagues, the professional healthcare manager needs to apply specialist knowledge and skills for the benefit of patients, clients, colleagues, and the organization. And this presupposes that the application of the expertise of judgment must be there, motivation and support given to others, the delivery of safe and high-quality services to patients and clients, and a positive contribution to achieving the objective of the organization. The Institute of Health Management, therefore, focuses on managing self, managing the organization, managing people, and managing the service. Honorable Speaker, honorable colleagues, you will agree with me that healthcare management delivery is a professional career that demands regulation and professionalization, such that the activities of each profession is regulated, entrance into the profession moderated, and the professional members inducted through the act of swearing to an oath to uphold the details and practice of the profession in Nigeria, as it is done in the United Kingdom, Canada, China, New Zealand, and other developed countries, and other developing countries like India and Malaysia, to mention a few. Nigeria must be in the college of countries that does it right in the healthcare management delivery system. And our graduates and professional members competing outstandingly with the rest of their colleagues around the globe, where best practices is driven by healthcare professionals. In conclusion, Mr. Speaker, honorable colleagues, the question therefore is, do we remain in this mess or take a bold step? Or I say we give the cap to whom it best fits. I therefore call for your support. There needs to be a process where our institution, our health facilities are properly managed by professionals who understand how to manage those facilities, not just professionals in their area of qualification. Management of facility, management of people, and all of that requires training. This is what happens in other climes. That's why year in, year out, our government invests a lot of money, billions in facilities, and you go to those facilities a few years later, it's like a ghost town. Things are not properly run, and we have to reinvest again and again. And each time we reinvest, because of the poor management, the situation remains the same. So the essence of this institute is to set standards and ensure that whoever, be you a medical doctor, be you a nurse, whoever you are that you want to run a facility, you acquire this special training to help you add to your professional qualification and run those facilities, save us the losses we've incurred and the mismanagement of our facilities. Thank you very much.
Favor of the motion say aye. Those against it say nay. The ayes have it.
And to make provisions, among other things, for the membership and control of the profession of healthcare management and for other related matters. Second reading.